Hello. I want to talk to you a little bit about the ADMIRE studies of mesenchymal stem cell treatment of perianal Crohn's disease. You'll remember that the ADMIRE CD study recruited more than 200 patients. It was a multi-centre randomised controlled trial with treatment and comparator arms. All the patients had an aggressive treatment regime, including curettage of the fistula tracts and placement of a ceton at the first EUA, and then 2 or 3 weeks later, further curettage of the tract with removal of the ceton, closure of the internal opening, and then injection of 120 million mesenchymal stem cells in the treatment arm and injection of saline in the comparator arm. First interesting thing about the study is the primary endpoint, which was combined remission. You'll know that in the majority of previous trials, including all the medical trials, testing things like infliximab, a clinical remission endpoint alone has been used, and that really just looked at closure of external openings and cessation of drainage. The addition of a radiological remission element to the combined remission endpoint in the ADMIRE study was trying to grasp whether or not the stem cell treatment was bringing about deep tissue healing, in addition to simple closure of the external openings. In the study, a third of patients in the comparator arm and a half of patients in the treatment arm achieved that combined remission endpoint at 6 months and also at a year. And that produces a delta of about 15% between the two arms.